Hi everybody. Now today we're going to look at we're going to continue looking at the skull, and today we're going to look at the skull from the lower aspect, and we're going to look at the base, the lower base of the skull. There's a lot of things to look at, and let's get started. Okay, so this is the base of the lower part of the skull, and so what do we see here? And is the inferior view of the anterior, middle, and posterior part of the base of the skull, and so let's look at these particular areas one by one. Now let's look at the anterior aspect here. So the anterior aspect here, we see, so this area here is basically the mouth area, all right? So but this is the upper jaw, this is the maxilla, so it's like this. So, okay. So you see this at the anterior view, and so basically this is the base, the lower part of the skull. So this is the maxilla or the upper jaw, and this is basically the mouth, the oral cavity. So what do we see here? We see the tooth, the alveolar arch or alveolar sockets, where you have the tooth sitting in the alveolar socket. So at the so we have these are the tooth, and these are the incisive tooth or teeth. All right. So we have two incisive tooth here, and next we have the canine, one canine. We have the two premolar, and then we have three molar. So totally we have 8, 2, 4, 6, 8. So this is 1/4 of the tooth. So this is the 8 tooth on one half. We have the 8 on the other half. We have 16. So this is the 16 teeth of the upper jaw, and then we have 16 tooth of the lower jaw. So totally we have the 32 teeth in our mouth. So we have two incisive, and then we have one canine. We have two premolar, and then we have the three molar tooth, and they are basically sitting in the alveolar sockets. So this is the hard palate of the oral cavity. So if you can feel it with your tongue, okay. So this is the front of your tongue. So if you do it like this, you can feel in the front of the upper part of the oral cavity, and this is hard. So this is basically the hard palate. And if you can feel your tongue at the back side, it's a little bit softer area, and that's basically called the soft palate. So this is the hard palate, and behind that is a soft palate. You can feel it with your tongue. And soft palate is basically composed of soft tissues like the muscles and the fascia. So this is the hard palate. Hard palate is basically formed by two important bones. One, the palatine process of the maxilla. So this is the palatine process of the maxilla, and this is the horizontal plate of the palatine bone. So this is the maxillary bone, this is the palatine bone. The palatine process of maxilla and the horizontal plate of palatine bone. All right, and the two maxillary bones, as you can see, unite in the middle. You have the suture here, right? Right maxilla and left maxilla here, and the maxillary bone unite with the palatine bone here at behind. This is the horizontal plate of the palatine bone, and maxillary unites with the palatine bone behind. All right, on the right side and on the left side. And if you look at the sutures that are formed, you have these cross-oriented or shaped suture. Look, I'm highlighting it like this. Okay, this is the vertical, and this is the horizontal, as you can see. And this basically, the suture is called the cruciform suture. It's like cross-shaped suture. Okay, so cruciform suture is basically composed of the intermaxillary suture, where you have the right and left maxilla come unite, and then you have the interpalatine suture, and we have the maxillary palatine suture, which connects the maxillary and palatine. So all these sutures come together and they form what we call as the cruciform suture. Okay, so what else do we see here? We see we have two foramens here. All right, on either side we have this foramen is the greater palatine foramen. Just behind that we have a couple of foramens here. We have the lesser palatine foramen. Greater palatine foramen, lesser palatine foramen, and these two foramens are located in the pyramidal process of the palatine bone. So this is the palatine bone, and this is the pyramidal process of the palatine bone. And then we have the greater palatine foramen and lesser palatine foramen. Greater palatine foramen carries or transmits the greater palatine nerve and vessels, and the lesser palatine foramen transmits the lesser palatine nerves and vessels. Okay, so what else do we have here? And we also have these incisive fossa, and inside this incisive fossa we have the incisive foramen. And again, in the incisive foramen, we have the incisive. We have the incisive. We have the nasopalatine nerves. Sorry, nasopalatine nerves and greater palatine vessels. So inside the incisive foramen, we have the nasopalatine nerve. Nasopalatine nerve basically comes from the nose, nasal cavity, and then comes out. So and then supply these areas. It receives the sensory information of the hard palate. So this is the nasopalatine because it's coming from the nose. Nasopalatine nerve, and then we have the greater palatine vessels that comes out. All right. So that's the what else do we have here? So this is the again, this is the palatine bone here. At the back here we have two openings. Okay, this opening is called the posterior nasal aperture here, and it is also referred to as the posterior choanae. This is the posterior nasal aperture. This is the nose, all right? So this is the nasal septum. On either side we have the nasal cavity. So if I put out this, you see, it comes out through here. So this is basically the nasal aperture. So this is the nasal cavity, and this is the oral cavity. So they have the oral cavity and they have the nasal cavity. All right. So you have the nasal cavity, you have the oral cavity. All right. So at the back of the nose, you have these two openings, and these are called the posterior nasal aperture or the choanae. It is also referred as choanae. And in between these cavities, you have this septum here. At the back, this is called the vomer. Remember, vomer is one of the important unpaired bones that make up the facial skeleton or visceral cranium. This is the vomer. Vomer basically is a triangular-shaped bone, which is located at the posterior aspect of the nasal septum. So it's a bone that makes part of the nasal septum, vomer. All right, and vomer has two ala. So this is the ala of the vomer, the right and the left alar, and these right and left alar of the vomer basically articulates with the head of the sphenoid. So basically, this area here is the head of the sphenoid. So vomer articulates with the head of the sphenoid. Okay, and so this part here is it is composed of two bones. We have the head of the sphenoid, and this part here is the basilar portion of the occipital bone. So the head of the sphenoid, and this is the basilar part of the occipital bone, and this area here is basically makes up the roof of the pharynx. So if this is the oral cavity, okay, so this is the mouth. And this area here is the pharynx. All right, so this is the oral cavity. And at the back here, when we call the basilar part of the occipital bone, is the pharynx. All right. Well, it makes up the roof of the pharynx. So, and on the basilar part of the pharynx, we have small pits that you can see here. These pits lodges the pharyngeal tonsils. And then we have these pharyngeal tubercle. This is a protrusion of a bone, what we call the pharyngeal tubercle, and serves attachment to pharyngeal musculature. Okay, so this is the medial aspect of the base of the skull. Okay, so in the medial aspect, what we see here is the vomer and the head of the sphenoid at the top, and then we have the basilar portion of the occipital bone. This is the median part of the base of the skull, and at the back we have the foramen magnum. So let's look at the lateral part of the base of the skull. The lateral part of the base of the skull, as you can see, is formed by these processes, and basically these processes is part of the sphenoid bone. So this is the pterygoid plate or pterygoid processes. So this is medial pterygoid plate, and this is the lateral pterygoid plate. So medial and lateral pterygoid plates are part of the sphenoid bone. All right. So this is the head of the sphenoid, and this is the medial pterygoid, and this is the lateral pterygoid, and these are part of the sphenoid bone. And what else do we see here? At the lateral part, so we're gonna go and look at that lateral part a bit later, and so this is the lateral pterygoid plate, and this area, it forms the medial border of the infratemporal fossa. Remember this area? So this is this is the zygomatic arch. So inferior to the zygomatic arch, this particular fossa is called the infratemporal fossa. So this infratemporal fossa, and basically this is the lateral pterygoid plate. So this lateral pterygoid plate forms a medial border of the infratemporal fossa. It's the infratemporal fossa, and this is the medial border of the infratemporal fossa. And by the way, this is the roof of the infratemporal fossa. And this is basically this is the greater wing of sphenoid. So the sphenoid comes all the way down here. So this is the greater wing of sphenoid, and then comes down here, and then you have the lateral pterygoid process of the sphenoid. So this whole thing is sphenoid bone. And on the lateral side, we have the temporal bone. This is the squamous part of the temporal bone. All right. And then we have the zygomatic process of the temporal bone, and this is the zygomatic arch. All right. So this part here is the temporal bone, and this is the mandibular fossa, where the condyle of the mandibular articulatus, and it's part of the temporal bone. Okay, so if we look at the pterygoid plates or processes, so we have the medial pterygoid plate, and then we have the lateral pterygoid plate. Medial pterygoid plate at the as it goes downwards. Okay, so this is the down part, the lower part of the medial pterygoid. You have this protrusion, and it resembles like a hammer, and this is called the hamulus, pterygoid hamulus. Okay, and this serves attachment to certain ligaments and muscles. All right, so this is medial pterygoid, lateral pterygoid. In between these medial and lateral pterygoid, we have the pterygoid fossa. So this here is referred to as pterygoid fossa. It is located between the medial and lateral pterygoid plate. So this is called the pterygoid fossa. And then we have another fossa called the scaphoid fossa. This is a scaphoid fossa here. So scaphoid fossa is on the it's located on the medial pterygoid. So it's on the lower portion of the medial pterygoid plate, and this is called the scaphoid fossa here. All right. And then we have two canals, like palatovaginal canal and vomerovaginal canal. So we have palatovaginal canal, or palatovaginal canal is located between the medial pterygoid plate and the palatine bone at the front here. So we have medial pterygoid plate and palatine bone. You have a canal here, and that canal is called the palatovaginal canal. And then we have a canal between the vomer and the medial pterygoid plate, and it's called the vomerovaginal canal. The reason why it's called vaginal is that this is called the vaginal process of medial pterygoid. Okay, so this is called the vaginal process of medial pterygoid, the vaginal process of sphenoid bone, whatever. Okay, so it's vaginal process of the medial pterygoid. It's between the vaginal process of medial pterygoid and the vomer, and it's called the vomerovaginal canal. And you have the vaginal process of medial pterygoid and palatine bone, and that is called the palatovaginal canal. So basically, these two canals it comes out the pharyngeal nerve, and you have the pharyngeal branches of the third part of the maxillary artery. So this is the pharyngeal nerve and pharyngeal branches comes out and supply the pharyngeal aspect of pharynx, so the mucosa of the pharynx. Okay, so these two canals. Okay, and then we go to the lateral side, to these opens again. We have on the greater wing of sphenoid, we have again these two important opens, foramen ovale and foramen spinosum. We saw these openings from the base, the interior part of the base of the skull. Okay. What we don't see from here on this aspect, we don't see the foramen rotundum. Why? The reason why is that foramen rotundum, if we look at it from the interior aspect, remember this is the foramen rotundum, ROS, R-O-S, rotundum ovale spinosum. Rotundum, the maxillary nerve passes through the rotundum, and it enters, as you can see, it enters to the inferior pterygopalatine fossa. So this area here is called the pterygopalatine fossa here. This maxillary nerve comes out from here, okay, and this area here is called the pterygopalatine fossa here. So it doesn't come out from the base of the skull, from a rotundum. However, the other two foramens, the foramen ovale and foramen spinosum, okay, so in foramen ovale, one of the important cranial nerves would be the mandibular branch, and the others would be in the foramen spinosum would be the meningeal vessels passing through, and they come out from the base of the skull. All right, all these structures come out from the base of the inferior aspect of the base of the skull. Okay, that's the difference. So you don't see foramen rotundum on the inferior aspect of the base of the skull. Why? Foramen rotundum comes out to the pterygopalatine fossa. Okay, so this is the foramen ovale, and then behind that we have the foramen spinosum. The reason why they call this foramen spinosum is that this area here, as you can see, is spinal crest. Okay, it's a crest, and it's a spinal crest, and that's why they call that as foramen spinosum, because of the spine that is located behind that. So this is called the spine of the sphenoid. So this bone again is part of the sphenoid bone, spine of the sphenoid, foramen spinosum, foramen ovale, and that's it. So we have these two important foramens passing through or located inside the sphenoid bone. Okay, so this is the sphenoid bone, the greater wing of sphenoid. Medial to that, we have this bone here, and this is the petrous portion of temporal bone. So we have the greater wing of sphenoid, we have the lateral pterygoid, we have the medial pterygoid, we have the basilar portion, the occipital bone, and in between the greater wing and the occipital bone, we have the petrous portion of temporal bone. All right, petrous portion of temporal bone is here, and in between the greater wing and petrous portion of temporal bone, we have a sulcus tubae, what we call that, sulcus tubae. All right, sulcus tubae is basically located between the greater wing of sphenoid and petrous portion of temporal bone. Sulcus tubae enlarges the cartilaginous part of the pharyngotympanic tube or Eustachian tube. We're going to look at that Eustachian tube. It's basically Eustachian tube or pharyngotympanic tube connects nasopharynx to the middle ear. So here it goes all the way down to the middle ear, and so this fissure or sulcus lodges this cartilaginous tube. All right, and it's called the sulcus tubae. So the greater wing, and then we have the petrous portion of temporal bone here. All right, now this part here is the apex of the petrous portion of temporal bone, and this is the apex of the petrous portion of temporal bone, and in front of this apex and behind or bordering this foramen would be the other area would be the sphenoid bone. Okay, so this is the greater wing of sphenoid, and we have the body of the sphenoid, and then we have the basilar part of the occipital bone, and then we have the apex of the petrous portion, and this foramen is the foramen lacerum. Okay, and we talked about foramen lacerum from inside. Remember, this area here would be the this is the foramen lacerum. Okay, foramen lacerum. So basically, this area is foramen lacerum, and where is it located? It's located just in front of the apex of the petrous portion of temporal bone, or next to the greater wing of sphenoid, or lateral to the basilar portion of the occipital bone. So this is the foramen lacerum. So, like I told you earlier, it has this irregular margin, and it's lacerated, and it's covered by the cartilaginous structure, and two important structures passes through the foramen lacerum, like I told you earlier, which would be the meningeal branch of ascendopharyngeal artery and emissary veins. So we have the meningeal branch of the ascendopharyngeal artery and emissary vein passes through foramen lacerum. And what else do we have here? This is the petrous portion of temporal bone. This canal here is the carotid canal. What passes through the carotid canal is the internal carotid artery, of course. And also, internal carotid artery, also the sympathetic plexus also traverse this canal, because the sympathetic plexus or sympathetic nerves passes along the wall of the major arteries, and one of them is the internal carotid artery. So through this internal carotid canal, you have the internal carotid artery, and also sympathetic plexus passes through this internal carotid artery. Okay, so and what else do we have here? So this is the petrous portion of temporal bone, all right. And what else do we have here? We have the mandibular fossa here. Okay, so this area here is the mandibular fossa, and this mandibular fossa articulates with the condylar process of mandibular bone. So this mandibular fossa, this fossa articulates with the condylar process of the mandible, like so. Okay, so we have the mandibular process, the condylar process. I'm sorry, we have the condylar process of the mandibular articulates with the fossa, the mandibular fossa of the temporal bone, and they form what we call as TMJ, temporomandibular joint, and which is what? Which is a movable joint, TMJ. Okay, so that's the mandibular fossa forming TMJ. And basically, what else do we have? We talked about the styloid. And then let's go to the median side here, and then we foramen magnum. We talked about foramen magnum. Like I told you earlier, we have the ligamentous anterior compartment, and then we have the neurovascular posterior compartment, which passes a lot of structures, which I told you earlier, like the anterior compartment would be the ligamentous, the apical ligament of Dens, for example. One of them is that, and then we have the posterior compartment. We have the lower part of the medulla oblongata meninges, the spinal root of accessory nerve, vertebral artery, sympathetic nerves, and then we have the anterior and posterior spinal arteries that come out from the vertebral artery. So these are the major structures that passes through the foramen magnum. And then we have the occipital condyles here, okay, and then we have the condyles, and this occipital condyles articulate with the first vertebra, okay, first vertebra. What else do we have here? We have this foramen here, which is called the jugular foramen, okay, just on either side, jugular foramen, and it's between the jugular process of the occipital bone, and then we have the petrous portion of temporal bone. In between that, we have the jugular foramen. Okay, this is the jugular foramen, and jugular foramen we have the certain structure passes through, like I told you earlier, internal jugular vein and inferior petrosal sinus, and then we have the 9, 10, 11 cranial nerves, 9 glossopharyngeal, 10 vagus, and 11 spinal accessory nerve, 9, 10, 11 cranial nerves. inferior petrosal nerve and internal jugular vein passes through the jugular foramen. And what else do we have here? On the medial aspect, we have the hypoglossal canal. So this is the hypoglossal canal, and through the hypoglossal canal, hypoglossal nerve, 12th cranial nerve, the hypoglossal nerve passes through that area. Okay, so and then just behind the okay, so and then we have the what else do we have? We have this foramen here, the condylar foramen, with emissary veins passes through these foramens. What else do we have here? We have the stylic process, okay. We have the stylic process here, okay, and 2 ligaments and 3 muscles attaches to the stylic process. Okay, 2 ligaments and 3 muscles attaches to the stylic process, like stylohyoid ligament and stylomandibular ligament, and 3 muscles like styloglossus, stylohyoid, and stylopharyngeus muscles originate from the stylic process. And then going laterally, we have the mastoid process here. Again, muscles attached from the mastoid process. Okay, we talked about that. 3 muscles: sternocleidomastoid, splenius capitis, and longissimus capitis, origins from this mastoid process here. And just beneath that, we have the gastric notch here. We have the digastric notch, or the mastoid notch, the digastric, where the posterior digastric muscle originates from here. And then we have a groove just next to that, where this groove, where you have the occipital artery, passes through this groove here. Okay, so what else do we have here? What else do we have? I think... Okay, what else do we have? I think we covered a lot of things here. Okay. And did I miss anything? I'm just take a look. Okay, I think we covered a lot of things. Oh, okay. One other thing that I forgot on the inferior aspect is on the occipital side, we have the external occipital protuberance here. Okay, so this is the external occipital protuberance, all right? This protuberance, and you can feel that on your occipital bone from your behind, okay, of your skull. You can feel that you have the external occipital protuberance, and you have the internal occipital protuberance. Remember, this is the internal occipital protuberance, and this is the external occipital protuberance, and which serves attachment for ligaments and muscles. And just beneath, next to it, you have the nuchal lines. You have the superior nuchal line on either side, right? Superior nuchal line. We have the inferior nuchal line, superior nuchal line, inferior nuchal line on either side, okay? And then we have another line above superior nuchal line. We have the supreme nuchal line. You have the supreme nuchal line, superior nuchal line, and we have the inferior nuchal line on the right side. On the left side, we have the supreme nuchal line, superior nuchal line, and we have the inferior nuchal line on the left side. And basically, these serves attachment to muscles and muscles, primarily muscles. So they have the external occipital protuberance. Here we have the crest, external occipital crest. So external occipital protuberance, external occipital crest, supreme nuchal line, superior nuchal line, and we have the inferior nuchal line. And this basically is the squamous part of the occipital bone. Okay. All right. Thank you very much for listening. I think we covered a lot of things, and it's a little bit complicated, I know, but this is skull. It's one of the important bones in the human body, and so that's why it's a little bit complicated. There's a lot of protrusions and crest and elevations and so forth. So I know you need to study a little bit more, but if you have any questions, I'll be around to answer them. And thank you very much for listening, and bye for now. Bye.